With more than 10 million wounds treated worldwide, 3M V.A.C therapy delivers the proven clinical outcomes caregivers can trust. This learning tool has been created to help you understand how easy the 3M V.A.C Simplicity Therapy System works and to clearly explain the proper use of the system. Keep in mind, as with any medical device, it is important to review all instructions with your healthcare provider and make sure all safety information is understood prior to use. The easy-to-use V.A.C Simplicity Therapy System is a medical device that is intended to create an environment that promotes wound healing by automatically delivering the most commonly prescribed negative 125 millimeters of mercury setting vacuum pressure to the wound. The portable V.A.C Simplicity Therapy Unit has been designed with large, easy-to-read buttons and a simple, easy-to-understand interface. Negative pressure helps draw wound edges together while removing wound fluids and promoting granulation tissue formation to fill the wound. V.A.C Therapy System is intended to promote wound healing, provide a moist wound healing environment, draw wound edges together, remove fluid and infectious materials, minimize the need for daily dressing changes. Make sure you are provided a V.A.C Simplicity Therapy Unit and 3M V.A.C Granufoam dressings or 3M V.A.C White Foam dressings and 300 milliliter canisters. The V.A.C Simplicity Therapy System uses proprietary foam dressings, V.A.C Granufoam dressing and/or V.A.C White Foam dressing with the therapy unit. Only 3M V.A.C dressings are to be used with 3M V.A.C therapy units. Wounds treated with the V.A.C therapy system should be monitored on a regular basis by your clinicians who are responsible for your treatment plan. It is recommended that V.A.C dressings be changed routinely every 48 to 72 hours, but not less than 3 times per week for non-infected wounds. If your wound is infected, your clinician will monitor your wound closely and may change your dressing more frequently. The V.A.C Simplicity Therapy Unit is designed to provide you comfort and mobility. Let's become familiar with the components and features of your therapy unit. Detailed information and references can be found in your V.A.C Simplicity Therapy Quick Reference Guide located in the pocket on the therapy unit carrying case. The important parts of your V.A.C Simplicity Therapy Unit are the easy-to-use control panel, the power and therapy on-off button, the power cord connection port, and the V.A.C canister. To charge your V.A.C Simplicity Therapy Unit, plug the AC power cord into the power supply. Plug the AC power plug into a wall outlet. Plug the charging cord connector securely into the therapy unit. To turn the power on or off, press and hold the Power and Therapy On-Off button for 3 seconds to turn the unit on and start therapy. The LED will be solid green. Press and hold the Power and Therapy On-Off button for 3 seconds to turn the unit off and stop therapy. The LED will turn off. Before starting therapy, ensure that the dressing is in place, the canister is connected, and all clamps are open. It is vital your V.A.C Simplicity Therapy Unit remains on for 22 hours of each 24-hour period. If therapy stops or the unit shuts off for any reason, call your doctor or nurse right away. Without active therapy, your dressing will need to be replaced within 2 hours. To silence the audible tone, press and release Audio Pause. Do not press and hold. The LED will be solid yellow. The audible tone will come back on in 60 minutes if the alert has not been fixed, and the audible tone will come back on in 2 minutes if the alarm has not been fixed. Other buttons you'll see on the control panel are AC power, battery level, blockage indicator, and leak indicator. When you insert the V.A.C Simplicity Therapy Unit into the carrying case, make sure you can clearly see the control panel through the cutout window. You can use the tubing storage straps to discreetly keep excess tubing out of sight. And remember to keep your therapy unit in the upright position. Alarms occur if the therapy is not activated, if the canister is full, if the tubing is blocked, if the tubing or dressing has leaks, or if the battery is on low power. Refer to your device quick reference guide located in the pocket of your carrying case or your V.A.C Simplicity Therapy Unit user manual for instructions on dealing with a specific alarm. The V.A.C canister collects excess wound fluid to help with your wound healing process. To change the canister, stop therapy by pressing the Power and Therapy On/Off button on the touchscreen. Do not turn the power off to the V.A.C Simplicity Therapy Unit. Slide both tubing clamps towards the tubing connector. Close both clamps tightly. You should hear several clicks. To disconnect the dressing tubing from the canister tubing, twist the connectors to unlock and pull them apart. Press downward on the canister latch release. Pull the canister directly away from the therapy unit. Install the new canister onto the therapy unit by sliding the canister over the canister latch guide until you hear an audible click. Compress, then twist to reconnect tubing connectors. Open both tubing clamps. Canisters must be discarded according to appropriate regulations. Please refer to the instructions provided to you by your healthcare provider. Contact your healthcare provider with any medical questions or if you are having any adverse effects. In case of an emergency, immediately call 911. For questions about V.A.C Simplicity Therapy System operation, call 1-800-275-4524. Thank you for watching. We hope you have a clear understanding and comfort with the V.A.C Simplicity Therapy System.